What if I told you that the most talked about weight loss drugs on the market could soon cost less than your monthly cell phone bill and might even be covered by Medicare? Stick around, because we're breaking down what could be a game changer for millions of Americans. So here's what's happening. The White House is reportedly hammering out a deal with two pharmaceutical giants, Eli Lilly and Novo Nordisk. These are the companies behind blockbuster obesity drugs like Wegovy and Zepbound, and the proposal: drop the price of these medications to just $149 a month for some patients. Plus, and this is huge, open up Medicare and Medicaid coverage for certain people who need them. But here's where it gets interesting. Right now, these drugs can cost over $1,000 a month without insurance. That's simply out of reach for most people. And while private insurance sometimes covers them, Medicare, the government health plan for Americans over 65, usually doesn't, which means millions of seniors with obesity have basically been priced out of the latest medical advances. And that's what makes this White House move so significant. If this deal goes through, it could slash monthly costs by more than 80%. Imagine the ripple effects. Suddenly, a treatment that was only available to a small sliver of the population could become accessible to millions more. For reference, more than 40% of US adults are considered obese. That's a staggering number, and it comes with higher risks of diabetes, heart disease, and other costly health problems. But there's another twist. Covering these drugs under Medicare and Medicaid could also change the way insurers and employers think about obesity treatment. If the government steps in, private companies might follow suit, expanding coverage to even more people. It's a domino effect that could reshape how we tackle one of the country's biggest health challenges. Now let's talk about why this is happening now. The demand for obesity drugs has absolutely exploded in the past few years. Prescriptions are up, and the conversation has shifted from "should we treat obesity" to "how can we afford to?" The pressure is on for drug makers to make these treatments more affordable, and for policymakers to address rising healthcare costs linked to obesity. But, and this is important, there are still big questions. Who exactly would qualify for the $149 price tag? How many people on Medicare or Medicaid would actually get covered? And could this lead to higher costs somewhere else in the system? After all, if millions more people start taking these drugs, the total bill could skyrocket, even with lower prices. And here's what no one tells you about risk. Whenever a new treatment becomes widely available, there's a chance of overuse, side effects, or shifting medical priorities. So experts will be watching closely to see how this plays out in the real world. Looking back, we've seen similar moments in healthcare before. Think about when Medicare started covering prescription drugs in 2006. That was a turning point for access and affordability. This new obesity drug deal could be another one of those historic pivots. So, is this the breakthrough that changes the healthcare landscape for good, or just the start of a much bigger debate about how we pay for innovation? Only time will tell. If you found this breakdown helpful, hit like, drop a comment with your thoughts, and don't forget to subscribe for more updates on the forces shaping your financial future. One thing's for sure. How we handle obesity drugs today could shape not just our health system, but our economy for years to come.